Bryony was excited for the birth of her daughter, the nursery ready and perfect. Little Emmy was perfect too, but she died at just 3 days old, having suffered a brain injury during birth.
When we left with just a box of footprints, that you just sit there in a state of shock, because what is so damaging is that Emmy was right there. She was right there to live, and they just never delivered her safely.
Today, an investigation into England's maternity services found women and babies are not being listened to. Racism and inequalities are embedded, the system fragmented and care inconsistent. It recommends a new statutory role of maternity commissioner to improve care. Triage services like A&E for maternity must be urgently reformed, and the brutal compensation system needs replacing.
Your report is the second on maternity failings that we've seen in just recent days. What are you going to do to ensure that your report doesn't just become another left on the shelf gathering dust?
The task force which has been set up to come up with an action plan, which will be a national action plan, that will be ongoing. I hope that if you do interview me in a year's time, I will be able to say that there has been some change.
Bhavna's son Joshan died just hours after his birth because of failings in care. She now campaigns to end race inequalities in maternity.
I don't want another parent to go through what we've gone through and what we are currently living through. Losing a baby is one of the worst unimaginable things any parent can go through, and it has to be an urgent change now.
So at her funeral, these are the poems that we had for her.
The hospital where Emmy was born says it remains deeply sorry and insists it's made significant improvements. While the vast majority of births in the UK are safe, the government is promising the first ever maternity commissioner and says this must be a watershed moment. Rebecca Barry, ITV News.
You begin your report by saying that words cannot describe the pain, suffering and trauma that you heard, but I wonder whether you could just try and convey to me the impact of maternity failings on families.
Well, we've seen it, haven't we? Year after year, time after time. Families who are having to relive trauma, who are having to tell us over and over again what happened to them because, one, they want justice for their babies or for the mothers who have been harmed or died. But also because they want the system to be different. And one of the shocking things about the investigation that I have just done is that there are already over 700 recommendations, some of them overlapping, but which are focused on maternal and neonatal care. And some have been implemented, some have not. But why has this gone on for so long? And that's why when I was asked to chair this investigation, I agreed, because I feel it's important that we get to the point where we identify the systemic challenges and begin a process of reforming and transforming our maternal and neonatal system for the future.
You found that racism and discrimination is embedded within the system. Just how concerning do you find that persistent inequalities in our maternity care?
Well, what we say in the report, and I think this is really important to recognise, is that organisations, health trusts, are partly a reflection of what is going on in wider society. And we were looking sometimes at trusts where geographically and in terms of their demography, who live there, they were very, very diverse. And grasping the nettle of that, having open conversations between your staff, with your patients about what is the impact of this on care. And of course, if you look at the statistics, you can see the impact in terms of health outcomes. So this is a safety critical issue for the NHS. This has got to shift. And one of our recommendations is that Trusts need to have more granular data, but they also need to investigate and interrogate the data that they have in terms of outcomes.
So should women and families trust their local maternity services right now?
I've been asked about that a lot, and what we saw was a lot of fragmentation and inconsistency. We saw good practice, we saw poor practice, we saw terrible practice. So it's very uneven, and I would not say to anyone, because I think it's really important that women who are pregnant, who are thinking about getting pregnant, it's important that they have the support of midwives. No one goes to work in the morning wanting to do harm. We need to remember that. We need to empower women and families to ask questions, to interrogate. And that's what I hope that the recommendations in my report will do. It's about informing, communicating, making sure that there is informed consent. It's going to be difficult in the short term. There's no way to get around that. But I do hope the fact that there has been so much focus on these issues means that women and families understand and know that they have rights, they have the right to challenge, they have the right to ask for a second opinion if they are not content. Please, please speak up, ask, and make sure you are comfortable about what you're being advised.
Your report is the second on maternity failings that we've seen in just recent days, and there are others in the pipeline. You've said yourself that there have been hundreds of recommendations. What are you going to do to ensure that your report doesn't just become another left on the shelf gathering dust?
Well, one of the reasons that I agreed to chair this investigation is because I was told by then Secretary of State Wes Streeting, and James Murray, the current Secretary of State, has confirmed this, that the task force which has been set up to come up with an action plan, which will be a national action plan to implement the recommendations that have been made, that will be ongoing. That's really important to me. And one of the major recommendations in the report, which has been agreed already by the Secretary of State, is to have a statutory, independent maternity commissioner who can give oversight, who can drive the system to implement the change. And the proposal in the report is that that commissioner co-chair the task force. So yes, you can have political leadership that comes and goes, but you will have a degree of stability in terms of that maternity commissioner and the task force.
But some campaigners, some bereaved families feel like that's the wrong direction, that having a maternity commissioner would be dangerous. It would concentrate too much power in one person's hands. What do you say to that?
Yes, and I've heard that. I heard one of the campaigners who was speaking about this. And I do hope that when the campaigners read the whole report, look at the suite of recommendations that we have made, because they connect with each other, they will see that this is not about concentrating power. This is about oversight. It's about independence. It's about reporting back to families on an annual basis, reporting to Parliament on an annual basis, reporting twice a year to the Health Select Committee, so that there is a spotlight shone on implementation and recognition when things aren't happening quickly enough. This is about oversight and accountability.
Some say that your report lacks scrutiny. Are you confident that your investigation does go far enough?
Well, there is always going to be more that could be done, and I'm not entirely sure what the criticism is in terms of lacking scrutiny. Those who look at the full report on the website will see that all the data that we collected, the responses to our call for evidence, it is all there. It can be looked at, and you will be able to see the direct route from what we heard and saw to the recommendations that we have made.
I know that it's not your place to make a decision, but do you agree with growing calls that there should be a public inquiry on this, a full statutory public inquiry?
I can completely understand and absolutely respect why families are calling for a statutory public inquiry. The failure, for example, of some clinicians to turn up and talk to families when things have gone wrong, I think is absolutely terrible. My personal view is that the recommendations that we have made, if implemented in full, have the ability to transform the maternal and neonatal system. So I do not see the need for a public inquiry, but that is not my decision to make. It is for the Secretary of State and it is for the government. And I repeat, I completely understand why families are asking for it, because some families have never had an answer as to why what happened.
Baroness Amos, at this point, do you feel optimistic that your report will be a genuine turning point? And if so, when will we see the changes that are so urgently needed? There
are some short-term things that I think can be done right now, which could make a huge difference. We've talked about the Maternity Commissioner, but we also talk in the report about what happens when women are concerned that something's not right. They have excessive bleeding. There's reduced movement of the baby. They become ill for whatever reason, and they really feel they need to be seen. That is called, if you turn up to have that looked at, that is called triage, the place that you go to. Normally you ring up first and then a decision is made as to whether or not you come in. We make some recommendations about what can be changed now to support women to feel more confident and to be listened to and not dismissed in relation to triage. And we ask that that happen over the next 3 months.
Are you optimistic that that will happen?
I hope so, because I have talked to trust chief executives in the visits that I have done. I've talked to the Secretary of State, I've talked to national leaders, and my understanding is that the recommendation about triage will be accepted. And that means that the system can start straight away. Leaders can start straight away to review what is happening now and put in place the things that they need to make the change.
A year from now, do you think I'm going to be conducting interviews like this again, asking the same questions again and again?
I hope not. I hope that if you do interview me in a year's time, I will be able to say that there has been some change. Yes, that there is a great deal more to do because culture change does take time, but I would want families to be able to say that they have seen a difference.
I'm joined now by Georgia Stevenson, who is head of the policy unit for the baby loss charities Sands and Tommy's. Thank you very much for coming in. What is your reaction to today's findings?
Well, I think the report tells what many of us working in this sector already know all too well, many of the issues. But I think what's really important is that it recognises that these are issues across the whole system. In the past, we've heard about issues in specific trusts, specific hospitals, but this really recognises that it's really across the country and we need the systemic change to improve those problems.
OK, one of the issues that has been raised in previous reports, including the one from Donna Ockenden that was published last week, is about whether women are pressurised into giving birth without any medical intervention, and that can be a caesarean section. Now, one of the advisors to this review, Dr. Bill Kirkup, resigned from this review just a couple of days ago. It's reported over the conclusions regarding whether women were put under pressure to give birth without medical intervention. Donna Ockenden has commented on his resignation today, saying she agrees with him that this is a national issue. Should this have been tackled more seriously in this report that's out today? As you say, this one that's collecting all these stories from across the country. And should the government be looking at it more seriously?
So the task force which will be taking forward the actions from this report, they will be looking at the recommendations that will be taken forward. The task force isn't limited to this report, so they could look at this in more detail.
Do you think it should be looked at in more detail? Do you believe women are being denied either epidurals, drug intervention or caesarean sections that can, Donna Ockenden has said, can in some cases lead to tragic consequences.
I think an issue that we've heard about in the report is around teams not working well together across different disciplines. So whether that's midwives or obstetricians not working together, and ideology and sort of what they're trained on is part of that issue. And I think it needs to be looked at in more detail.
What's going to change in terms of making birth safer for the woman and for the unborn baby when we're talking constantly about this culture, this toxicity within some of these wards, within some of these relationships between these staff? Is a task force or maternity commissioner really going to bring about that change?
So I think the task force will be looking at all of the recommendations that have been made for maternity and neonatal services. So it's nearly 900 in the last decade or so. So staff are overwhelmed with those numbers of recommendations. We really need to take a step back and get back to the basics of what safe care means and what is needed to deliver that care for women and birthing people. So I think the task force really needs to go back to basics in a way and build that what that looks like for the future.
What is your advice right now for anybody who's thinking of trying for a baby or indeed is pregnant at the moment? Because the task force, the maternity commissioner, these are all things that people are thinking about and talking about within the months, years to come. What about right now?
So the advice for anyone who is pregnant right now is if you have any concerns at all, then speak to your healthcare professional, whether that's about your own health or a change in your baby's movements.
And what do you do if
care.
you believe that you have spoken up or somebody has spoken up on your behalf and you are still not listened to? Because that is what we're hearing time and time again.
So the NHS is now piloting Martha's Rule in maternity services. So this gives families an opportunity to ask for a second medical opinion. And it's been a recurring theme. People don't feel listened to, and we're waiting to see the data of the pilot, but we're hoping that will give families another mechanism to get a second opinion when they're not feeling like they're being taken seriously.
Just briefly, are you surprised that Martha's Rule, Martha's Law is only just being considered for maternity wards when we know it's been brought in elsewhere?
So it already is part of a pilot. So the pilots are underway. That started earlier this year. So we'll be looking out for the data on the impact of that.
We will indeed. Georgia Stevenson, thank you very much for coming in and for your thoughts on this big day.